There's many things that I'm passionate about with palliative medicine. I think the first thing that comes to mind is just that relationship. You get to kind of dig in with families and really understand their family unit and their values and their culture, and it just, I don't know, it's just so nice to honor somebody, especially whenever they're heading towards the end of life, and it can be a beautiful experience for them even when it's end of life. You know, we all celebrate coming into this world, and I think we should celebrate going out of this world. I can't tell you how many times we've had family meetings and the ICU doctors or whomever might say, gosh, this is going to be a very difficult talk with this family, and we bring in maybe a chaplain or a priest or somebody from their church unit, and there's not medical questions to be asked, it's spiritual questions, or they just need to make sure we're honoring and valuing their culture or their religious beliefs, and that's all the questions they have. It's actually not even medical questions, so it'll surprise you sometimes. I think we see stuff every day that we worry that we're not preserving somebody's dignity, and the tubes and the wires and the everything in the ICU. I think it's all very, one of those things that I don't think any of us would plan for at our death. I mean, maybe there are some of us that would, but I think it's interesting to watch families go from that setting to maybe tubes and wires are coming off of a patient, and then everybody's so relieved that they're seeing their loved one in their natural state and how they normally look, and they're just, the sense of relief over the whole family and the patient is amazing. Oh, the speech pathologists are just so wonderful. I feel like they have that special connection at the bedside, and they know, the families know that y'all are really working hard with them, and I think they always seem to have a way of like normalizing the process to families and saying, you know, gosh, we sometimes see this with families, and this is what this is the next step if you want to go down this path. And they're just very, I'm amazed at what a great job you guys do. And I think, you know, some of those things like normalizing and giving them the safe means to go down a route of comfort or pleasure feeding, and just letting them know that this is a very natural process. Well, I think the thing that happens a lot of times, and I'm not even sure it's among speech pathologists, but we'll have a patient and family and they're all on the same page of, gosh, we just want to allow our loved one to eat, even if they have a risk of aspiration, and we want to do it as safe as possible. And the speech pathologist or whomever may come in the room and say, well, you're just going to let them choke, or, you know, use the word starve if they've come down a path that they're not going to feed them something. So the words choke and starve and anything like that really definitely goes underneath our skin. So
scary.
Yes, exactly. And those are words that I think are put the family on, like maybe we've done something wrong and like we're not honoring that family. Most patients, obviously we want to make sure we're getting exactly what the patient wants, but a lot of times these patients are relying upon their sons or their daughters or their husbands, and they want the family to make decisions as a unit, and that's kind of cultural dependent too, I think. If we're taking a very holistic approach, we definitely want to always be making sure people are being taken care of emotionally and spiritually as well as physically. I think in the hospital we're very good at always focusing on the physical. We need to just, you know, continue to remember that they have emotional needs, spiritual needs, and so getting your counselors involved, getting your clergy people involved. You'll see such a phenomenal response from families when they know you're looking at you as a whole person. I don't know how many times I hear that, like, oh, you looked at me as I'm a whole person.